Moving on to the second part of this presentation, let's go to evaluation. So there are two types of evaluation. The first one is the outcome evaluation. This measures how well the ACSM intervention has met its objectives and what should be changed to improve future ACSM activities. So, to conduct an outcome evaluation, here are the steps that one must follow. First, determine what information the evaluation must provide, then define the data to collect. Decide on the data collection methods and then develop and pre-test data collection instruments. After development and pre-testing, then we proceed with data collection, processing, and then analyze the data to answer evaluation questions. And once all of these are done, we proceed with writing the evaluation report. And then once written, of course, we have to disseminate the evaluation report. The second type is impact evaluation. This connects behavior change to health or social outcomes. This is not commonly used by planners of ACSM activities because of high costs involved in carrying them out successfully. But in the event an ACSM planner would prefer to conduct impact evaluation, the question that must be answered is this: did the individuals who changed their behavior experience improvements in the intended health or social outcomes? Now, moving on to setting evaluation goals, here are the preliminary steps before we set the evaluation goals. So the first one is to determine the stakeholders. So this will primarily be the stakeholders involved in ACSM activities or those who has direct interest on the programs or on the program. This could also be those who wants to learn from the program or potential future partners who will provide or who may provide external perspectives to the ACSM activities. The second one, after deciding on who should be involved, we have to determine what they want to learn or what they want or what they wish to get from the evaluation. So this could be maybe if your target or if one of our stakeholders are donors, so they will want to know whether the donation or the money was well spent, and if it's a policymaker, maybe they wanted to know whether the media campaign led to improvements in the targeted program or behavior or outcome within the community. And then lastly, determine which aspects of the outcome evaluation plan best fit with the program's priorities. So before we fully set out the evaluation goals, we have to determine which aspects of the outcome best fits the program's priorities. Kasi 'di ba, when we implement a program, marami tayong pwedeng gamiting evaluation goals, but we have to prioritize based on kung ano ba yung pinaka-objective ng program. So we have to consider which of those evaluation goals best fit the priorities of the program. So what are some questions to ask in setting up objectives for the evaluation are as follows. So what are the ACSM objectives? So, in determining which aspects of the outcome we should focus on, here are some guide questions that a planner can use. So, number one, what are the objectives of the program? How is the change expected to occur? So, what measurable intermediate outcomes or steps toward the desired behavior are likely to take place before the behavior change can occur? And then, second one or the third one will be how long will the intervention last? And the last one is which outcome evaluation methods can capture the scope of the change that is likely to have occurred. Now, the next one is we have to determine the suggested indicators or KPI, key performance indicators. When identifying KPIs, your KPIs or our KPIs should be SMART, meaning it should be specific, measurable, achievable, result oriented and time bound. And KPIs could have two different kinds or two different levels. We have individual level indicators, and second one is community level indicators. Under individual level indicators, things that we can into consideration are knowledge, attitudes, belief, behavior, stage of willingness to change, and demographics. Well, for community level indicators, we have policy and regulation, or these are the measures: policy and regulation, information accessibility, behavior, social norms, including stigma, presence, or mobilization of social networks. So these are the measures that we can use for our KPIs, specific measures, I mean. Now, once we have this, we can start developing an evaluation plan. Now, at a minimum, an evaluation plan should answer several key questions. So these are what are the project's objectives and expected outcomes? What questions should be asked? So when we talk about project objectives and expected outcomes, we should ask what elements of the project worked, what elements did not work, what were the successes, what were the failures, what still remains to be done, and what is the vision for the future. We can also ask about capacity, which capacity or how capacities being strengthened during intervention, and which results obtained during the intervention are likely to be sustained or improved upon. The second question that we have to take in con- take into consideration in crafting an evaluation plan would be what information is needed to answer the above questions, and how will the information be collected. So we have to consider what or how we will collect the information or the data. Should we be doing survey? Are we going to do interviews, group discussions, things like that? And then the third one, who will collect the information? And then what resources or materials will be needed to collect the information? And then the last one will be when will the information be collected? So we have to create a timeline for data collection when we talk about um, when will be the information collected. Now, how do we select the monitoring and evaluation methods? So there are two main methods used in monitoring and evaluating ACSM programs. We have qualitative methods and quantitative methods. So qualitative methods may include in-depth interviews, focus group discussions, or anecdotal feedback mechanisms such as diaries and observational studies, while quantitative methods may include sales data, service statistics, or surveys. Another method that we can use to monitor and evaluate ACSM program is participatory method, which allows or it helps in defining the issues. So the participatory method helps define the issues and work out solutions rather than just being sources from which information are extracted. So participatory methods provide ample opportunity for personal exchange to allow adequate time for people to go at their own pace. So when we talk about participatory method, it's just like participatory research, where the researcher engage with those who are directly involved or affected by the subject of the study by getting their feedback and their insights. So yun yung paano nila na-evaluate yung ACSM program. Next is developing and pre-testing data collection instruments. So in developing the instrument, these are the three main things that we have to consider. What data or which data, kanino manggagaling, and how. Paano mo kukunin yung data? So the data collected should be directly related to the evaluation questions, and evaluators should decide how many members of each group are required in the evaluation to measure the change, or to measure if there is significant changes before and after implementing the intervention, and how do we assess available resources before we decide on the data collection procedure. Now, after we gather the data, after we analyze the data, we now proceed with the writing of the evaluation report. So, an evaluation report should have the following: it should present the lessons learned in a clear format that can be easily digested by others who may be planning future ACSM activities, demonstrate accountability to employers, partners, and funding agencies, or simply stakeholders, provide evidence of the effectiveness of ACSM intervention and activities, and create a formal record to serve as an institutional memory of what has been tried, which partners had strong skills or experience in specific areas, what problems were encountered, and what successes were achieved. So, in sum, creating, um, in summary, monitoring and evaluating an ACSM project is a systematic process where we have to carefully plan each aspect of the monitoring and evaluation tool. So we have to take in mind or to consider who our stakeholders are, what they need, and what data we need. How can we use this data? How can we improve the overall flow or cycle of the program? So there are a lot of things we have to consider in creating an evaluation or a monitoring and evaluation tool for an ACSM program. Now, to end this report, I would like to, since we're already talking about monitoring and evaluating an activity or a program, I'd like to leave this question with you all. The balance scorecard also aims to monitor and evaluate the progress of a particular activity or a program. Do you think the balanced scorecard framework can provide an effective structure for evaluating ACSM interventions in particular? So, this ends my report. Thank you so much for listening.